Welcome to Create Momentum podcast for positive mindset. Today our guest is Dr. Lavan. We're gonna discuss about mental health and depression. As the current situation, COVID-19, a lot of people has gone through in depression. So this is my subject for today. Welcome, Dr. Lavan. First of all, I want to ask you how you been and how's your weekend?
Thank you, Shahzad. Thank you so much for inviting me today. It's a pleasure to be on your show. Yes, how has the week been? How's the weekend? It's difficult, isn't it? As we tend to get some positivity and improvement and some control, we always step back a little bit. Recently, with the news that the virus itself has mutated, has worried a few people, a lot of patients have come in. So it's a difficult one. Just as we progress, we are stepping back and coming forward. And as you started the show, it's a positive mindset that we have to keep at our forefront.
Absolutely, because if we don't keep our mind in a positive way or positive direction, obviously there is so much negativity. As you know, COVID-19 or coronavirus, since December started, a lot of people must be going through in difficulties. And one of the main reason is depression. Because whenever you turn on the TV, when you see the death rates, they are not regular. So everybody feel that that's it. It's like end of the world. So what do you have to say on the current situation, the people who go through depression, stress, anxiety, or mentally disorder?
So yeah, very important question, Sajad. I think the most important thing I want everyone to take away from this is no one is weak. This idea that people are weaker because they're going through anxiety, stress, or depression, that's incorrect. That's nonsense. I'll be honest and say myself, I've suffered quite significant episodes of anxiety and stress during this time, and I would class myself as someone who's very positive and thinks in a very positive mindset. So the most important thing is this has changed the way the world is functioning. This has changed the way human beings are interacting with each other. So the numbers are definitely going up. If I give you examples, Shahzad, this was about 4 months ago, a Monday there, we got about 530 calls in a morning through the practice, and 320 of those calls were anxiety-related calls because of coronavirus. Now, these are people who are, high-flying people who work in the city, in the banking industry. These are people who work in clubs and bars, and they are all struggling with their mental health because we are living in a different place where, you have to remember to wear your mask wherever you go or bring it with you. You have to make sure when you go and see a relative, you don't hug them. You go and see a friend very, very rarely, or maybe sometimes in the garden. I'm sure you or some of the listeners here, they may not even have seen friends or family for so long. And we forget sometimes that these friends and family, we may not always speak to them, we may not always see them, but they are part of our structure of positivity. So when that's taken away from us, it's very difficult for us to function as normal. And actually, frustrations that we have, whether that's financial or whether that's with family, close relatives that we see regularly, they start to show themselves more. So we are finding it very difficult with the anxiety and stress. And more than ever, we as doctors are reaching for further help to help these patients. So whether that's through what we call cognitive behavioral therapy or counseling, where you actually sit and talk to someone professionally, and sadly, even medications, we are prescribing more than we've had before. But most importantly, with this kind of anxiety and stress, is to try and keep that positive mindset, because a lot of it can be managed well in that mental being, but also thinking about herbal remedies, thinking about taking appropriate vitamins, thinking about doing right exercise, eating very well. All of these have a positive impact and should hopefully see us through this difficult time.
Yeah, absolutely. Because when you go to depressions, the things happen. You don't want to eat properly, or you eat more, or it's a sleep disorder. You lower self-esteem, lack of motivation. So many things happen. But because see, I was reading as well that on a Google, if you read, there will be reading help to reduce the stress 68%. But there is different, because I always been a fan of self-development. So read, either you go to positive or negative. If you give a negative message to your mind. Let's say you're getting off from the house and you say today is a bad day. So you already given that message to your subconscious mind that, oh, today my day is going to be bad. And it eventually happened because you're believing on the statement, which is, I mean, completely wrong. People have to be, but different people have different, what do you say, they think in a different way. We all think in a different way. Now, everybody's not going to be positive like me. It's an emotion when it's triggered. So, as you said, so how we can, like, situation like this happen, like when you see in a television there's a lot of deaths happening, and the rates are going high, so how people can keep themselves calm, not to stress and distress?
Absolutely. Yeah, good question, Shazad. And it's important to take this on board. If you asked me 3 months ago where we didn't have a virus, where we didn't have plans, it would worry me. I mean, if you think of when it first became big, March, April time, I was scared, and I'm a medical professional who's very positive. I was thinking, should I rent a caravan outside my house so I don't infect my family inside? You know, we were very scared of this virus. No one had ever known. The wonderful thing now is, now with the NHS, we understand the virus better. If the deaths we were having at the start, it was because we didn't understand. We were bringing patients in and panicking. Now we know how to manage these patients, even in our primary care, the first level, but also in hospital. The doctors are much, much more efficient and more knowledgeable about it. So God forbid you were to go into hospital, that panic we had at the start, we won't have that anymore. We will be much more controlled in the situation. The second thing is to remember is we do have a vaccine now. We actually have another vaccine coming through and a third vaccine coming through. So we have got the support. A year ago, we didn't have any of this, whereas now we have already vaccinated about 350,000 people in this country. And this week, I'll be vaccinating patients as well. So we have started the process of over 90-year-olds, over 80-year-olds, those vulnerable people that we worry about most, and those people who have significant conditions, we are already vaccinating with them. So this light people talk about, we always need a light. When we wake up in the morning, first thing, exactly like you said, Shaza, we shouldn't think negatively. We should think optimistically. We should do things that make us happy. So whether that's going to the gym, doing exercise, drinking a glass of water, doing yoga, meditation, that should be the start of our day. And we need to push away the negatives. People are talking about the Brexit things. People are talking about corona deaths. Yes, that's there. Nothing's going to change that. You'll have two types of people. One type of person says, Brexit's happening, whatever the case. COVID deaths are happening, whatever the case. But it's how we manage it. And we have got positivity. As a doctor now, I feel so much more confident than I was a year ago. We're trying, you know, you see people wearing the mask, you see people washing their hands. People weren't washing their hands before opening doors or going into shopping centers. People are trying. So we are definitely in a more positive area or positive place than we were previously. The fact is now we need time. We need that 6 months now to really ensure this vaccination is put through the whole population, or as many people as possible, and then we will see that light at the end of the tunnel.
Absolutely. When things happen in the, I mean, when things happened, I mean, in the beginning, everybody was confused what to do, not to do, what we will do. They were completely confused. Now they know, they have a ray of hope. They can see the light end of a tunnel. But most of the time, the common things I see, I mean, the corporate people, the corporate world, you can see is so much stressful. If you are in a higher position, and one of our friend was telling us they get a higher pay, but their stress level and everything is high. And people, even though come on a Monday, they get two days as a day off. And then when they come on a Monday, they're completely depressed. They're not loving their job, or they are just in their routine. I mean, this is a daily thing. How would you keep yourself positive and not to think about that, okay, today is Monday, it's going to be a stressful thing? How people can do that?
Yeah, absolutely. So it's a mindset concern. So 2 points with that is, one, if you are in a position where you are falling into that mindset, you do need to step away and reflect on the situation. You need to see, do I need to do this? So if you are the city banker that is earning, a large sums of money, but actually dropping a day or having a less stressed job would mean a bit of a drop in income, but your quality of life would improve. You need to value that, because actually stress now, the amount of stress we're having in our bodies, this rat race that we're doing, chasing money or help or position, sadly does have an impact on our health. It affects the way cancers develop. It affects the increased risk of strokes, of heart attacks, because stress is such a key factor. Now, if someone told you, saying, you taking that extra money but working so much harder and stressing yourself out will end up ending your life earlier, I'm sure your family and yourself will stop you straight there and say it's not worth it. You'll look at your children and you'll say, no, I can't do that. The flip side is where you need the money. So say there is a lower income earner, but they have to work so hard for that certain money. You then need to find the beauty in why you're doing that. So I look at, some of our parents maybe, or other generations where they came maybe to this country to earn money. They enjoyed that stress. They wanted it because they wanted a better life for their children. And if you can see that, work becomes more enjoyable in that sense, because yes, I'm going into work, I'm working really hard, it is stressful, but I know the smile on my child's face, or the education I can provide, or the food, or whatever it is I can provide. So you need to find the goodness in all aspects. We're all dealt bad cards. People probably look at us and they'll probably look at me and say, oh, Dr. Lavan, he's got his nice practices, he's doing this for fun, he must be earning lots. And I admit I earn well, but I have very sad stories. A lot of my family suffering from cancer have died from cancer. But that's more the reason why I want to try and help people more, to educate them about cancer. But we all have that. No one has the perfect life. If you look at even the richest person, Jeff Bezos, who runs Amazon, I'm sure if you looked very deeply, whether it's he's being divorced or whatever, everyone has an issue, but it's how you deal with it. We all have suffering, but we have to see past it. Now, acutely, it will be terrible. You will say, I can't get out of this. Finances are bad. Family are dying. I can't deal with this. But again, this light at the end of the tunnel, you have to see the silver lining. You have to see what good can come out of it. Okay, if someone dies, but my children are still here, I need to support my children. Therefore, I need to get up, I need to stand up, and I need to work hard. Actually, there's no benefit of getting into a lower position where you're getting down and depressed. You can be like that, but you need to grab for help, whether that's friends, whether that's family, whether that's your own doctor. You need to reach for help, because we have ways to help to get you out of that, to bring you back to that positive mindset.
Absolutely. So, what it is, when the depression come, there's addiction in, like, let's say gambling,
Yes.
because sometimes people go through that. But when you are losing money, your mind is not working, because you're chasing the money to which you lost. Then when you're left with nothing, you go home, and the situation is you are crying, and some people has taken their own lives. They didn't think. You become selfish in a way, getting depressed. Okay, how I can get out of it? Let's say I had that situation long time back, but I believe it's only when you divert your attention. If you don't divert your attention, if you keep yourself, let's say, self-isolating. When you self-isolate yourself and you don't want to talk with anybody, and then everything is in your heart, and you keep a burden on yourself, and you're not telling anybody. So I believe sometime you need to come out of the box and tell people whatever the problem is. Maybe the people couldn't help you to solve the problem, but you can. But slowly but surely you can do it. So you cry whatsoever. When person is depressed, they don't want to do anything, because they think their low self-esteem, lack of motivation, they don't have no energy to do anything. So you have to work, you have to keep your mind busy. Then that is the solution to get away from the depression. And everything can be resolved. It's in life we have to be good in solving problem. I think one of the reason is, when the problem happen, people think the problem for 95%. It should be other way around. Only 5% you think, and 95% you think what is the solution for it, for any issue. As soon as the coronavirus came in, I mean, I was completely anxious. For 2 days, I didn't eat food in the night. Then I did research, and then it came out. It's been there long, from 1960s. People gonna come to know now. When you do your research, and Tony Robbins is my favorite author.
Yeah.
So he said in US 600 people die from flu. So I mean, people need to do research, and everything you're telling them, they say it's a conspiracy theory. They don't want to listen to you. So what message would you like to give people if they come across to this situation, what they need to do, and how they can be positive, keep themselves positive, and have faith that everything gonna be better?
Yeah, there's very good. It's a good point to bring up and to summarize where it's that key factor you mentioned about reaching out for help. It could be a random family friend. We've had cases where patients have someone passing, and in the funeral there's a relative of a relative who comes and says, if you need anything, or they say something that resonates with that person, and they realize, oh, I'll keep your number and I'll contact you. It may not be the best friend, it may not be your wife, it may not be your sister that you end up confiding in, but there'll always be someone who's happy to listen. And now mental health has become such a big deal. There's so much of it, and you're absolutely right, Shazad. It's the death that worries us, especially in young males. We are getting a huge number of deaths as a result of it. And what we're trying to do is we get, a group of population where you say a female of 50 or 60, who as soon as she feels low will come and ask for help, which is the right thing. And we can direct her and push her through the services. But these young men, they're not coming to us, or people who shy away or don't feel like we can help in any way, don't bother coming. But it is about picking up the signs, watching, are they not eating as much as they used to, or eating too much? Are they not sleeping or sleeping too much? Have they got a lack of motivation? They used to come and meet us at this cafe, they don't come anymore. And picking up those signs and maybe actually making that effort as friends or family to make that call. Are you okay? And it may sound annoying, but it's worth checking a few times. Actually, no, I'm not okay. Okay, would you like to go for a walk? And just getting that information, but reassuring them that this is temporary. Whenever there's a situation, there's so much that can be done. Yes, no one's going to throw money. Sadly, we don't live in a world where I could just give $1 million to that person and fix their financial problems. But you'll be amazed to hear how many good people there are. There are areas, I know, there's a young lady who was very sad and getting quite depressed about money. And her biggest thing is she wanted to make a big first birthday for her child. That was her thing. If she could do that, she would be the happiest woman in the world, and it would build her up again. There's a charity in the area I live in, Sutton, where they make birthday cakes for free for first year birthdays. What a wonderful thing to have a charity that will do that. Now, they did that. This lady, she didn't need antidepressants. She didn't need exercise, diet, anything like that. That itself elevated her. She then got active. She got out of this phase that she was struggling with, went to the gym, started working. Now I don't see her. She's very successful. She's doing lovely, earning well for her child. So you can see even small examples where help may not come directly as advice or guidance, but someone could do a gesture to someone, and it gives a bit of faith in humanity where they think, oh, wow, someone has done that for me without taking anything from me. And that itself can be the energy that we need to build up into a positive place. So exactly like said Shasta, this is all temporary. Whenever we're going through anxiety, depression, we control how long it has to be. When there's a death, a bereavement, it could be 1 week, it could be 6 months. Now, even if it's 1 week, of course, you're still going to be upset in 6 months. No one's denying that, but we can manage it better if we get that energy to come out of it. So if ever you're feeling anxious or low, do reach out to someone, friends, family, your doctor. Even one word to your doctor can give you a whole list of people to contact that may fit in quite nicely.
Thank you very much, Doctor, for your help, for your time. And as I saw you, as I saw your profile on Instagram, it is good, and you're giving a good message to the people that people can take advantage of it. And I will leave everything in a description if anybody wants to reach out to you, so they can use your Instagram. Are you happy to?
Absolutely. Any way I can help, I'd be honored if I can help people. So that's absolutely.
So I will do that. And any message from your side for it's going to be a new year, and any new year resolutions you have, or you want to spread it to other people? Anything from your side?
Absolutely. So everyone, it's been such a difficult year. We've all suffered, me included, friends and family, but we do need to think positively. We need to start the new year fresh. We have got a vaccine. We're in the right direction. It may not seem like it currently with the fact that we're not having Christmas, but the start from January, make sure you start your New Year's resolution with doing exercise, eating healthy. I'm not saying you're going to be doing that all the way through for the whole year, but at least it's a good way to start. If you drink alcohol, cut down or stop. Drugs, stop it. Smoking, stop it. Let's try and be fresh and healthy, and it will help the mind. And good luck to everyone. And thank you, Shahzad, also for giving me this opportunity. And thank you for the good work of positivity, because we need more people like yourself spreading that.
Thank you. I'm really grateful that you have taken the time out to come to support as well for Create Momentum podcast. And we will be in keep in touch in future if there is any other subject to be discussed. So you are most welcome.
Oh, thank you, Shahzad. I'll take that opportunity anytime. Thank you very much, Shahzad.
You're welcome, sir.